some of that answer does have to we do have to think about kind of structural reasons for why women die in pregnancy and childbirth in this country. We noted in our analysis that Black and Hispanic patients were disproportionately affected, that we also saw a higher burden of deaths across geography, with a higher number of deaths occurring in urban locations. And a lot of the MMRC recommendations focused across reducing delay across patient, community, and provider levels. And so addressing systemic issues that disproportionately affect minority patients, as well as patients that might have barriers to access to care, is really important. Some of the interventions will be local and will have to do with how different systems access and reach their patients. But from what we've seen, improving and expanding access to local medical care, including through postpartum telemedicine visits, mobile health clinics, postpartum telephone check-ins, may be a way to improve retention and care postpartum, as well as understanding that patients may not present to their OBs, but will present to many different other facilities, including emergency room departments, urgent care visits, and even their child's pediatrician. And that suggests a role for interdisciplinary and interdisciplinary care protocols that can enhance provider recognition, as well as referral pathways that can diminish burden of patients to seek care, but improve their ability to access care where they are. One of the things that this highlights is that, the diagnostic criteria for infection and sepsis are not uniform, and that many of the, clinical presentations do overlap with what can be considered normal in pregnancy, such as maternal tachycardia or leukocytosis, or that some things are absent in pregnancy, like fever, but we must still maintain a high index of suspicion. So that's really important, is that all people have maintain a high index of suspicion for infection and evaluate accordingly. The other piece that's important is the role of continuing education. And one of the MMRC recommendations was that all health professionals who may see pregnant or recently pregnant women receive education and training on sepsis recognition, management, and that there is the availability of cross-disciplinary support. So this means that patients who, present with concerns like abdominal pain or fever are asked about recent pregnancy, irrespective of the way the pregnancy ended, and that they are given tools to receive a complete evaluation, including pelvic exams when indicated, and that the differential diagnosis is broadened to include those that could be pregnancy complications.